Let them let them think you're a bitch. I was waiting in exam room recently for a post-op for a recent knee surgery that I had, thinking of the differences in the imaging reports and the actual pathology that was found, and trying to understand what could be so different. The radiologist obviously isn't out personally trying to sabotage my knee well-being or my ankle as it was, or kidney things. Large misses from radiologists that I've had in my medical history. And I asked her, hey, is there a way that maybe there's a subset of us that present differently, or maybe help me understand what's going on here? She started explaining the science of what's showing up on some of the imaging reports, just kind of a good refresher for me on that. But then also that, hey, she's got the clinical information. She hears what I'm saying. She's feeling my knee. She can feel it pop. She can feel the catch when I move it a certain way that the radiologist simply doesn't have. They have a diagnosis and an image. And so what they may see is possibly within normal limits. She understands that with these symptoms that I have and with these testing results that I have, that that may not be normal for me. But she spoke that the issues that arise often come from insurances. She's an NP that's reading her own images. And when she says, hey, there's pathology that needs to be treated, hey, can we get this pre authorized? But there's an MD that has documented that there is no pathology, that can be a really tricky thing to navigate. It's hard enough to get insurance approvals as it is, let alone when there's an MD that says that there is no pathology to be dealt with. So that she has called on multiple occasions and said, hey, can we look at this together? Hey, would you show me? Hey, maybe would you teach me? Maybe I'm not seeing something. Maybe I'm seeing something. Would you help me learn what you're seeing? She said, but that's one end of the spectrum. She doesn't then want them to think that she's dumb or that she doesn't know, because she very well does know. She's a brilliant orthopedic nurse practitioner. She's wonderful. I love her. But that the other flip side of that is, hey, can we look at this again? Hey, I'm seeing something that wasn't listed. She doesn't wanna be a bitch either. She said, "Hey, I don't wanna be a bitch." And how many of us have navigated this line? So when she said, "I don't want them to think I'm a bitch," the response was, "Let them." I learned over the years that trying to so delicately put things and so delicately trying to protect egos, it was not my job. If your ego is that fragile, it is not my responsibility to caretake it. A, but B, and then she said it, after a time or two, they respect you. And it's true. If you say, hey, I'm seeing this, let's look at this, and they can come to respect you then. Those that care, those that want to do a good job, those that don't have the fragile egos, would say, hey, she knows her shit. She's doing this well. She's catching things. She has this other understanding. Yeah, she's great at this. But the ones who are going to think you're a bitch are the ones who have missed things before, who are worried what other people think about them, who are in their insecurities about not being good enough. You ain't got time for that. You're trying to take care of your patients. And here's the thing, people that also want to do well for their patients won't think you're a bitch. Right? The people that you actually want to work with, the people that you want to be on your team and be your colleague to take care of the patients that are in front of you, that you love taking care of, that you love being a resource for them, on their health journey, their orthopedic journey, they will be able to see that you are trying to do the right thing for your patient. So they're going to respect you for standing up for your patient, saying, hey, let's look at this again. Hey, yeah, that could be within normal limits, but this clinical testing is suggesting that it is not normal for them. You're going to do it out of a place of caring. You're going to do it out of a place of wanting to do well. And if somebody thinks less of you for that, that's not on you. That's not your job. That's not your responsibility to caretake that. No, I get it. Here's the thing that in some of these small towns, there is one radiologist. In this hospital system, there may be one that does knee imaging. And if you get shoe poking their insecurities and triggering them, then that could be a tricky thing to deal with. Now, here's the thing, you start documenting and you show people, hey, this is a concern. I've got these images and this result, and these images and this result. Now, if you are in a corporate system, they're going to eventually get rid of that person, get another person, or let you go out of the system. There are second opinions to be had. There are ways to work around this. You are the resource for your patient. So if there is one that you catch on, there are options out there. There are other radiologists. We can do all of this remote work now. We can let the systems support you. You'll get to stand in your truth. You'll get to be the provider that you want to be. If they think you are a bitch for trying to take care of your patients, let them.